This is Kumaraswamy. I work as a CEO for Surakshaa Group of Hospitals, and we have been attempting to do a few podcasts on the medical subjects. I think last time also we did a podcast on PCOS and PCOD, which was again a bothering issue for the young girls and even married ladies also. So this time we are coming out with a subject called as Dermoid Cyst. Okay. I would request Dr. Nandhini to speak about it, and she's been our obstetrics and gynecologist, and she's been working with more than a year. I think she would be able to introduce to you on her own. That would be the much better one. Yes.
Yeah. Hello all, this is Dr. V. Nandhini, consultant obstetrician and gynecologist currently working at Surakshaa Hospitals.
Well, madam, as I already told you, this is the subject is today Dermoid Cyst. And it is definitely been quite rare, awareness has been quite less. At the same time, it is necessary for every young woman to know about this dermoid, because it's a silent one, right? So I would like to request you to tell me something about this dermoid cyst. What is dermoid cyst?
So dermoid cysts are benign tumours, they are non-cancerous. So they arise from germ cells of ovary. They are called dermoids because they have tooth-like structures, skin-like structures, sebaceous glands. This origin is basically from germ cells of ovary. That's why they are named as dermoids. And they are also called as mature cystic teratomas. They are purely benign, they are non-cancerous.
Very good, doctor. This was very good a start for a dermoid cyst. And what is dermoid cyst? This is the best answer you were able to make it. But I would like to ask you one more question, doctor. That normally this dermoid cyst, who commonly gets this?
So dermoid cysts are very common in reproductive age group women between 20 to 40 years old, but they are also seen in young girls.
Since the young girls are, what is the cause for the dermoid cyst, doctor? What actually happens?
Most common theories are they are like congenital problem. They arise from the embryo phase itself. So they are embryonic developmental problems. So because of that, the germ cells of ovary, they are already totipotent cells. So they have a tendency to develop into different types of tissue. So that's why they form like skin-like materials in the dermoid cyst, tooth-like structures in the dermoid cyst, bone-like structures, sebaceous glands, some fatty materials. So they are all like present in dermoid cyst. So that's why mostly cause will be embryonic developmental problem.
For example, any disease for that matter, like it's a dermoid cyst or any medical issue, it normally has a symptoms.
Yeah.
So with respect to dermoid cyst, doctor, what are the symptoms a girl can experience?
So most common problem with dermoid cyst is they are very silent, slowly growing. So diagnosing them is a quite challenging thing. So if mostly patients present with symptoms like abdominal distension, pain in the abdomen, sometimes irregular menstrual cycles. So that's most common.
So definitely the symptoms looks to be little scary.
Yeah.
But however, after the symptoms, doctor, what is the complications the lady is going to find with the dermoid cyst? When it is found, when it is already found, what complications a lady can experience this?
So most common and most serious things are like ovarian cyst torsion. Because of the heaviness of the dermoid cyst, there is chance that ovarian cyst will get torted, means rotated. So that is the most common thing. And the other complications might be rupture of the dermoid cyst, infection and malignancy. Infections and malignancy are quite rare for the dermoid cyst, but ovarian torsion and infections are common.
Okay. So having understood the symptoms and what it causes and how it happens and all that, even the complications also. Now, probably everybody will be understanding that having got the treatment done, what is the possibilities of recurrence? Normally when we take a treatment, probably a surgical procedure happens and dermoid cyst is removed. Then the question anybody will going to ask is, doctor, is it going to come back again?
Yeah.
The recurrence is the question which everybody will be asking. So what do you say about this?
So for that, first we have to diagnose the dermoid cyst correctly. So most common investigation for dermoid cyst or ultrasound is sufficient. Ultrasound abdomen and pelvis will definitely diagnose dermoid cyst. If required, we'll go ahead with CT scan or MRI scans. So about surgical treatment of ovarian dermoid cyst removal. surgical treatment is the only option. So surgical removal of the dermoid cyst is the treatment of choice. So there are two options. If the dermoid cysts are small, it can be removed through laparoscopically, but if it is quite large in size and if it is complicated, then the most common procedure is it has to be removed along with the ovary. That is called oophorectomy.
Okay.
So their chances of surviving, like chances of retaining the ovaries will be difficult.
Okay.
Otherwise, we can preserve the ovary as far as possible if the dermoid cysts are small in size.
Okay. Now back to the same question, doctor.
Yeah, recurrences. If you ask me, recurrences are very rare. But I will not tell that it's not going to happen.
Possible.
Yeah, it can happen, but very rare.
Okay.
But they should be vigilant about the symptoms.
Then can we know something about this prognosis, doctor? Where are we going to head it, or what's the prognosis about the dermoid cyst?
Prognosis is excellent because these are benign tumours, and once removed, they are very stable and they are not going to grow very fast also. So mostly after surgical removal, the chances of prognosis is very good.
So having come up to this extent in dermoid cyst subject, doctor, the question is about what is that you would like to tell the girls or the women who are suffering with this, or prevention is better than cure. That's what we talk about.
Correct.
What is that takeaways you like to give them?
So I would like to tell that. So ovarian cysts, mainly like dermoid cysts, are very common in young age women. So mainly in reproductive age group women. So they should be vigilant about that. If any abdominal discomfort, as they grow silently and slowly, they should be very vigilant about any abdominal distension and come to hospital immediately for consultation, so that we can prevent kind of damage. If we detect it early phase, the main thing is we can preserve the ovary as far as possible. If it is too late, then preservation of the ovary will be the problem, then fertility issues will be the problem. So early the treatment, early the better the prognosis.
Okay. So it can also, because the ovary is involved in that, so how is the chances? Do they think that really they'll get into fertility issues?
Yeah, definitely, because the other ovaries will be most of the time normal, so that will maintain the fertility.
Yeah.
The dermoid cysts are small. We can just remove the dermoid and we can try to preserve as much as ovary as possible. So that should maintain the fertility. So that's not a problem.
So the question is again, if the patient is ignorant, if the patient is not able to get the alert at the right time. If the ovary size becomes too big,
correct,
obviously the ovary also gets involved and they have to lose the ovary.
Yes.
And is it that this dermoid cyst happens only in the ovary, right ovary or left ovary, or both the ovaries also can happen?
We can't tell. It can be unilateral or bilateral. It can involve single ovary or double ovary.
Because why I was asking is in case if it is going to be both the ovaries are involved in that. God forbid, a lady should not land into real infertility issues. That's fine, doctor. And in this particular occasion, I understand that normally pain is the one thing which pulls the patient back to you.
Right.
And in case I personally feel that the pain is one thing which is a blessing in disguise for all of us. Unless until we feel the pain, we don't look at the doctor also.
Yeah.
So this particular situation, doctor, where the lady has to get alarms about the pain and she goes to ultrasound or MRI and diagnose the things and all that. At this particular subject, doctor, I also like to put it on a record. It happened in Surakshaa Hospital and you did it.
Yeah.
Okay. And it was a massive size of dermoid cyst.
Yeah.
And instead of me talking about this, doctor, I think you should be able to talk about this experience.
Our gynae team has managed recently a dermoid cyst of around 2 kgs. So one patient walked in with abdominal distension and pain on and off. Then when I did per-abdomen examination, I felt mass of around like 24 to 28 week size. Then I have sent her for scan. Scan has diagnosed it like dermoid cyst of like 20 centimeter into 18 centimeter to 18 centimeter.
Okay.
So I explained about like some chances of fertility, her surgical options. As it is like little complicated and it is very huge, we couldn't go ahead with laparoscopy. So then I went ahead and I did we have put vertical incision. Then I had to remove the dermoid cyst. Then we weighed that. It weighed about 2 kg.
My goodness.
So The problem is I couldn't save that ovary because it's very massive. But I checked on other ovary, that is absolutely fine. So her fertility will be fine.
Yeah. And all said and done, doctor, my experience with you is whenever we discussed about any kind of a gynec issues, your participation and the way you explain and all that is very, very admirable. Okay?
Thank you.
And I hope that we will be having many more occasions of these kind of subjects where we should be able to bring in that kind of a scientific information and takeaways and how you people need to perceive these kind of issues and all that we will be able to tell. But however, thank you so much for your time spared, and it was wonderful talking to you.
Thank you.
Thank you so much.
Thank you.